zone, Matthias, aka Mr. 16 Bars. That's real hip hop.
We try to tell people that Philly is a special breed. They hate to see us on top, they hate to see us on, they hate to see us come up, they hate we on, they hate the moves that we make because it's made to break them. We give them knowledge on tracks and hope our words can save them. I guess it's hard to give props when you know you lesser, so we right on your heels, I hope you feel the pressure. Rappers taking a roll, my shoes will never fit them before you come at it.
Continuing our journey down the list of the top 100 most influential Philadelphians, we're now joined by Dr. Cacchione, who is the CEO of Jefferson Healthcare University. Dr. Cacchione, welcome to Philly on the Rise. How are you?
Great day.
Great day indeed. How was your Thanksgiving? Did you have a lot of people over? Did you have a lot of turkey to eat?
We did. We traveled. We were back in my hometown of Erie, on the other side of the state. I've got a lot of family there, and got to see all my brothers and nephews and nieces, and big Italian family, and but it was good to catch up with everybody.
Good to catch up. Good to catch up indeed. How did you feel when you found out that you were number 16 on Philly Mag's top 100 most influential Philadelphians?
You know, it's a very first of all, it's an honor to be considered, and some of the folks that are on this list, I'm honored to be on a list with them. I would say that, you know, I represent 65,000 colleagues at Jefferson that give me the ability to be on this list, and it's my pleasure and privilege to lead this organization. And I think what my being on this list is a reflection of all the things that they do for the community. And it's not just to me, it's about a Jefferson Award, and it's less about Joe Cacchione and more about who we represent, who we lead, and all the people that make contributions to our respective communities that come to work every day at Jefferson.
Your post began as CEO in 2022, shortly after the pandemic, and like most hospitals, Jefferson had its challenges.
Yeah, the challenges of COVID were very real. There were personal challenges for our employees. There were financial challenges for the health system. There were supplies challenges for patients. There were everybody was affected by the pandemic, and you know, I think Jefferson has come out of it, and we are recovered for the most part from COVID. I don't know that we've recovered fully from a financial standpoint, but psychologically, that will become part of the history of healthcare in this country. It has impacted the number of people that go into the field, and that's created some shortages for us. It's forced some early retirements because people are tired from the 3 or 4 years that we dealt with COVID. So it dogs us, but you know, as a system, we see COVID very much in the rearview mirror, but it's had a lasting impact on many aspects of the business, as well as the people, more importantly, the people that were working in the business at that time.
It was a tough time for all of us. Jefferson, you mentioned some of the challenges that you had, but you did spearhead something amazing. 2024, you spearheaded a merger that helped to turn Jefferson into a $15 billion U.S. healthcare system.
Yeah, no, listen, I think that these things are because of some of the things that happened during COVID, and because of where we believe healthcare is heading. We do think that integration and size and the scope that we are able to achieve now with Lehigh and our health plan, some of the work that was done prior to me, really puts us in a good position moving forward from a strategic standpoint. And we think that we'll strengthen healthcare here and across all of our footprint, including the Lehigh Valley. We've got bumps in the road, like anytime you do a merger like this. It takes a while to integrate. We have focused on culture. And, you know, I will tell you from day one when I met with their CEO, Brian Nestor, who's now the chief operating officer of Jefferson, the cultural alignment between he and I and our entire leadership team and the entire system was pretty remarkable. And I think that provides a really good foundation moving forward for an integrated financing and delivery system.
Talk about addressing culture. What other initiatives have you put in place to help Jefferson become one of the top 15 U.S. nonprofit healthcare systems?
I think in healthcare, it starts with really good physicians and nurses and providers. And we have a great nursing team headed by Kate Fitzpatrick, our chief nurse, academically oriented, but great caregivers. They are just an outstanding nursing department. Our physicians, we've now continued to recruit and retain some of the best physicians in the area and frankly in the country. We've been able to bring on new physicians, mixing with the existing physicians across the entire system, to create really a top flight medical community. For us, one of the outside affirmations of that is we became NCI designated in the last couple of years, a National Cancer Institute designated comprehensive center, one of only 20 or so or 30 or so in the country. I'm not sure the exact number, but it really distinguishes us and makes us different. And very proud of that work. We're very proud of all of our services. We have some of the top cardiac surgeons. We have some of one of the best neuroscience programs in the country, led by Rob Rosenwasser. We have a great orthopedic partnership with Rothman, which is one of the top orthopedic groups in the country. This really is a great clinical enterprise that delivers very high tech and high touch care that is, I think, differentiated in the area.
Speak to hospital-centric versus healthcare-centric care.
Yeah, I think that's part of our mission and our vision for the future is today, most health systems are sick care, right? You come into the hospital, you need a surgery, we do the surgery, you go home. You were sick, we may not see you again for 8 weeks, and we see it once a year after that. But we really want to get to is really getting upstream from that and making it and aligning the incentive around that. Today, we get paid more when people are sick. We've got to be able to have an economic system that rewards us for lowering the total cost of care and improving the health of the community. And today we do that only when people are sick. We don't do it when there's no value to the health system other than doing what's right by making sure that you're on the appropriate medicines and you've had the appropriate screening procedures. So this is to us, what the change in that is that we do things now to prevent you from coming into the hospital, which in the past, we would see you coming into the hospital as more lucrative for the system. We're now engaged in making this so that it is less lucrative for us. It's actually better for the community if you don't come into the hospital. It's clearly better for you. It's better for the community. And in some ways, Jefferson is healthier and be able to reinvest in all the technology that we need to help keep you out of the hospital in the future. So some people say it's a play on words. It's really not. It's true that we need to be able to manage populations and do things to keep people out of the hospital instead of being rewarded for having people in the hospital.
You raise an interesting point, keeping people out of the hospital. Does that in a way affect your bottom line?
Yeah, right. Today it does, right? Because every time you come in, it would cost it. If I prevent you from coming in because I did something proactively to keep you out of the hospital, boy, that's great for you. It's great because it reduces overall cost, but it actually hurts us because our beds are empty then. And so we've got to be able to figure out if we can create a system where the hospital has some incentive, or the healthcare system has an incentive to keep you out of the hospital as much as it does having an incentive to put you in the hospital to have surgery.
Talk to us about the mission of Jefferson and the effect it's having on the residents of Philly.
Yeah, I would say we are 100% a mission-driven organization. And every time I stumble around that, our employees will call me on it. So I'm very happy with that, because our employees are here because our simple mission is that we improve lives. And we do that in multiple ways. By caring for the sick, but we're doing things like improving the lives of our students at our university, improving the lives of our insurance beneficiaries. We're doing things for them that makes addressing issues of health literacy, addressing social determinants of health, people that don't have access or have loneliness is a big. We are addressing the social determinants of health and every one of our patients that dawn our door. We talk to them about: do you have food insecurity? Do you feel safe in your home? Are you lonely? Do you have an ability to get prescription medicines? Are you homeless? And so we are addressing not only the physical needs, but the social needs of people, because they're intimately tied together. And so that mission of we improving lives ties that all in very nicely. And we contribute so much in terms of programs and things that we don't get paid for in the community. We have a whole department that really is the community impact department. And what their job is to make sure that we are engaged with the community. In 2024, our 200-year anniversary, we provided 200,000 hours of volunteerism. And all of our employees, every time we would put something out there, our employees we would be oversubscribed in a minute. Jefferson is the leader in providing community benefit in this community, provided $1.8 billion across Eastern Pennsylvania and New Jersey last year on community benefit, and including charity care, Medicaid patients. We are the leader by percentage and by total number. So Jefferson is 100% committed to the mission of we improving lives, regardless of where those lives are. And we need to address disparities in care that occur in some of our more challenging neighborhoods, and we need to address those things. We need to be part of the solution. Some days we'll be the convener. Some days we may be convened by others, and we're happy. But our job is to improve the lives of people in this community.
Amazing, amazing. If I could speak for all of Philadelphia, I would like to say thank you, Jefferson, for all of the work you are doing. On a personal note, you have known since you were a kid that you wanted to be a doctor.
Yeah. Listen, I was just telling somebody this the other day, because I have 3 children. I actually have 6 children, a blended family. But like, none of my kids went into medicine. And I knew from when I was 5 that I wanted to be a doctor. I mean, from the time I was old enough to know that I was going to work someday, I wanted to be a doctor. And then in 5th grade, I wrote a letter to a heart surgeon, said I was going to be a heart doctor someday. And so I have to learn to be more patient with my own kids, who are still trying to figure out exactly what they want to do in life. And because I knew from the time I was able to remember anything that I wanted to be a doctor and a heart doctor. Now, I never thought that I'd end up be the fortunate person to lead an organization of 65,000 people so committed to a community. And that's the honor is all mine to do that. But I still live that need for caring for our fellow humans, and that either was as a cardiologist when I did that for many years, and now as a leader of a large healthcare organization.
Born in Pennsylvania, educated in Pennsylvania, now living in Philly. Why do you love this city so much?
Well, listen, I'm a Pennsylvania boy by DNA. Grew up on the other side of the state. Went to medical school here. Went to college in Pennsylvania. I mean, I'm through and through a Pennsylvanian. I would say the appeal of Philly for me is the some people talk about the grit and grace of Philly, and that I may be that matches a little bit of my personality, that grit and grace. There are times we need to be gritty, and there are times we need to be graceful, and I think that lines up to my personality pretty well. And this city, it was like coming home when I came back here. I mean, I lived on 19th and Spring Garden when I was here in medical school. I now live on Rittenhouse, which is about 6 blocks from where I lived 40 years ago when I was here in medical school. So the world's a small place, right? And the degree of separation from 40 years ago till now is remarkable to me that I only made it 6 blocks.
All right. Are you ready for the Dr. Cacchione pop quiz?
Sure.
All right. Say you're ready. Here it goes. Here it is. There were multiple actors from Philly who played medical doctors on television. Name one of them.
Ben Casey. How's that? That's really old. You're probably too old to remember that. Dr. Ben Casey was one of the first doctor shows. How's that one?
Very good. Very good. Can you name another?
I would say I'm not much for doctor shows these days, but I'll say Dr. Chad Everett from Medical Center back in the 70s there.
Okay, this guy. Whoa, man, you're 2 for 2. 2 for 2. Don't forget Jack Klugman. He played in Quincy, M.E.
Oh, yeah, Jack Klugman. Yeah.
There you go. Here's another one for you. David Morris played in St. Elsewhere.
Yeah, I do remember that. Marcus Welby was on in the 70s. And there were a couple of doctors on Grey's Anatomy. There were Dr. McDreamy and Dr. McSteamy. Was that right?
Okay.
There were some crazy names of doctors that, but we did watch in medical school, we watched St. Elsewhere.
Okay. All right.
And yeah.
Good stuff. Good stuff. So when you have some downtime, I mean, obviously you're super busy. Being the successful CEO that you are, number 16 on the list. When you have some downtime, I hear there's some par fours and some birdies that you like to do.
Yeah, no, I'm a golfer, and I'm when I have, having 6 children, we're busy a lot, and they age range from 29 down to 13. So that keeps us hopping. But I have engaged my kids on golfing, so I can take them golfing. So it gives me an excuse to get out of the house. But I do golf. I've golfed in many of the Union League courses around the city, because I'm a member of the Union League, but I've played at Marion and many of the courses and have been fortunate enough to play some of the great golf courses of Philadelphia. And it's a fun sport for me because it's a lot about the camaraderie and who you're playing with. And I do like I'm a little competitive, so I like the competition too.
Understood. Well, once again, congratulations, number 16. And I don't know if I can speak for all of Philadelphia, but thank you once again for all of the work that Jefferson is doing in the community. We thank you for joining us for this segment of Philly on the Rise, and we'll talk to you soon.
Thank you very much. Appreciate it, Mike.
Welcome.